If you're on tirzepatide and finding yourself reaching for an extra sweater more often, you're not alone. This is often reported by people during treatment, and it's connected to how your body is changing as you lose weight. Before we dive in, a quick note. This video is educational and not medical advice. Always talk with your healthcare professional about your specific symptoms and situation. So what exactly is tirzepatide? It's a dual GP and GLP-1 receptor agonist, FDA approved for type 2 diabetes under the brand name Mounjaro, and for chronic weight management as Zepbound. While feeling cold isn't listed as a direct side effect in the official prescribing information, it's not uncommon for patients to report increased cold sensitivity during treatment. Here's what's likely happening. The cold sensations aren't caused by the medication directly messing with your body's temperature regulation. Instead, they're typically related to the weight loss that tirzepatide helps you achieve. As you lose weight, you're also losing adipose tissue, which is your body's natural insulation. Less insulation means you may feel environmental temperature changes more easily than before. There's another factor at play too. During weight loss, your body may lower its basal metabolic rate as an adaptive mechanism. This is sometimes called adaptive thermogenesis. When your metabolism adjusts this way, your body produces less heat, which can add to that feeling of being cold. So if you're feeling chilly on tirzepatide, it's often related to weight loss rather than a direct drug reaction to the medication itself. Now, while feeling cold is usually just an inconvenient part of the weight loss process, there are times when it needs medical attention. If you're experiencing cold intolerance along with severe fatigue, hair loss, cognitive changes, or changes in your heart rate, contact your doctor right away. These symptoms together could indicate a thyroid issue that needs evaluation. Your doctor may want to check your thyroid function with blood tests. Let's talk about managing this cold sensitivity so you can stay comfortable while continuing your treatment. Layered clothing is your friend. It gives you flexibility to adjust throughout the day as your comfort level changes. Research suggests maintaining indoor temperatures between 68 and 72 degrees Fahrenheit can help. Nutrition matters too. Adequate protein intake supports your metabolic rate during weight loss. Talk to your healthcare provider about what protein intake is right for you based on your individual needs. Regular physical activity can also help. Exercise generates heat and may help maintain your metabolic rate. Again, discuss an appropriate exercise plan with your doctor, especially if you're new to regular activity. It's worth mentioning that tirzepatide's most common side effects are gastrointestinal, like nausea and diarrhea. If you're experiencing these symptoms, staying hydrated becomes even more important. Dehydration can make you feel colder and can worsen gastrointestinal side effects. Speaking of hydration, make sure you're drinking enough fluids, especially if you're dealing with any digestive side effects. Warm beverages can serve double duty, helping with hydration while also warming you up. Remember, everyone's experience with tirzepatide is different. What works for one person might not work for another. That's why it's so important to have open conversations with your healthcare provider about what you're experiencing. They can help you determine whether your cold sensitivity is within the normal range or if it needs further investigation. Your doctor can also help you weigh the benefits of continued treatment against any discomfort you're experiencing. For most people, feeling a bit cold is a manageable inconvenience compared to the health benefits of weight loss and improved blood sugar control, but that's a decision you should make together with your healthcare team based on your individual situation. So here are your key takeaways. Cold sensations on tirzepatide are typically related to weight loss, reducing your body's insulation, and potentially lowering your metabolic rate. They're likely not from the drug directly affecting temperature regulation. Most of the time, this is manageable with practical strategies like layering clothing and maintaining good nutrition. But if cold intolerance comes with severe fatigue, hair loss, cognitive changes, or heart rate changes, contact your doctor for evaluation. Have you experienced cold sensitivity on tirzepatide? What strategies have helped you stay comfortable? Drop a comment below, and if you found this helpful, give us a like and subscribe for more evidence-based information about weight management and metabolic health.